Now for this next question is kind of like trying to talk about all the sickle cell crises in one question, which is like one of the most likely examination questions they might actually ask you in pediatrics. So they said that you should discuss sickle cell crisis in children and you should state the preventive measures towards them. Let's quickly move on. So sickle cell crisis just refers to some acute episodes, like some 1 or 2 complications that they come in because the sickle cell disease is actually there. So okay, so it primarily leads to pain, anemia, organ dysfunction. Okay, so types of sickle cell crisis is we have the Vaso Occlusive crisis. So this one, the blood is sickling, so it kind of like blocks the blood vessels. Okay, so severe bone pain, you can have what swelling of the hands and foot. That's what dactylitis. So most sickle cell crises, they don't just start, they're usually caused by a trigger. All right, so this one can be triggered by what? Dehydration, cold, infections, stress, hypoxia. Then we also have the acute splenic crisis. This one, the blood is actually going into the spleen so much. Okay, so it causes rapid enlargement of the spleen, causes severe anemia, there's shock, there's pallor, there's tachycardia, so it's life-threatening. Then we have the aplastic crisis. Okay, aplastic crisis is when your bone marrow is not producing red blood cells enough again. Okay, so you have a very low reticulocyte count, where it's usually triggered by a parvovirus B19 infection. Then we have the hyperhemolytic crisis. This one, there's like so much breakdown of red blood cells, so the child is having this intense jaundice, there's dark urine, there's severe anemia, there's high bilirubin. Okay, the acute chest syndrome, that's when there's chest pain, there's cough, there's fever, there's low oxygen, there's difficulties breathing and all of that. Then priapism, you can have a painful prolonged penis erection. Okay, painful prolonged penis erection. It's common in boys that have sickle cell disease. Okay, can actually lead to erectile dysfunctions too. So preventive measures in children with sickle cell disease is most of them now, their immune system is weak, they are prone to infection, so you have to be preventing infections, and they have to take all their vaccinations, right? All those pneumococcal vaccinations, Haemophilus, influenza type B vaccinations, meningococcal vaccinations, then and all of that. Okay, then hydroxyurea therapy, it will increase the fetal hemoglobin, reduces the frequency of painful crises, or those acute chest syndrome, and also what they need for transfusions. Okay, the next, adequate hydration. So good hydrations, right? Adequate hydrations. Then for anything that is triggering the issue, you should try to avoid the triggers. So maybe exposure to cold, avoid it. Avoid any strenuous activities. Avoid high altitudes. Then manage stress. Okay, so regular clinic follow-up is growth monitoring, screen for complications, okay, and all of that. Then nutritional support is you have adequate folic acid supplementation, then also healthy diets. Then blood transfusions is if there's high risk, you transfuse. Then you educate the family and the patient. So teach the parents how to palpate spleen, how to recognize early crises. Okay, and of course sometimes if there's self-medications, how to comply with the dosings.